I call ROCD relationship substantiation. It's a subset of OCD where a person is preoccupied with establishing whether their feelings for their partner are sufficient to maintain the relationship or be in the relationship. People with ROCD have a tsunami of emotional distress over often more meaningless aspects of their partner in terms of whether they would be a suitable partner. And so there's a tremendous amount of endless navigation or rumination about the qualities of what they think are correct or justified to continue in the relationship with. There's just an endless preoccupation, there's an endless answer seeking, sometimes even reassurance seeking from one's partner. Being in a relationship is one of the most complicated endeavors we take on voluntarily as human beings. Relationships involve tremendous compromise and also a natural evaluation as it's developing in terms of the justification for remaining in it or finding someone who may be better suited for us. And sometimes even after a year where we transition to the idea of, is this someone that I want to spend the rest of my life with? Reignites once again that kind of questioning about, is this the right person? Is this the right time? Does this person's qualities match with my ideal of a lifelong partner? So these are just natural questions that everyone in a relationship has to transition through. Common symptoms of relationship OCD involve endless answer seeking and endless rumination about their partner's qualities and whether their internal feelings justify being in the relationship. They become very focused on their level of arousal as a proof that the person that they're with is justified to remain with. The problem is the more that we focus on and put pressure on ourselves to have a very passionate response, the less likely we are to have that response. And so it's common that there's a tremendous amount of sexual kind of malfunctioning or sexual apathy because of that inverse relationship between the pressure to be sexually aroused and then the way the brain responds sexually to that pressure. It's very paradoxical. There can be a focus on a partner's appearance, there can be a focus on a partner's character. I've had patients have associations about loved ones' own dating history in terms of how long did their partner wait before they engaged in certain sexual acts, as if that would provide them with reassuring evidence or uncomfortable evidence about their partner's character. They might read articles about the definition of a successful relationship. They might speak to friends about what makes their relationships, by definition, successful. There is a very emotionally driven basis for people with ROCD to establish whether or not they might love the person enough or whether the person's minor defects might justify ending the relationship. I think one of the most common misconceptions about relationship OCD is the idea of not understanding that relationships evolve from the first 2 months of it being a very passionate, romantically experienced process to a more calm and intimate process with one's partner. Another misconception is the idea that if we're with our significant other and they are meant to be our significant other, that we shouldn't find other people attractive. I'm always amused at the lack of insight that so many people have, that they still possess this idea of their one and only actually existing in the world, as opposed to there are many one and onlys in the world. It's just a matter of how we manage the negotiations and the endless maintenance of a relationship, so that we can be with someone who's very meaningful to us and that we're very committed to, and yet still notice that there are others in the world that we find very attractive, and that doesn't mean that we're not with someone that justifies our incredible devotion to. That's one of the most common misconceptions. I encourage partners of patients with ROCD to encourage a lot of transparency in the spike theme, the association, the intrusive thought. I encourage a lot of transparency, and I encourage the partners to not bring their ego into that disclosure. It's really important that the partners understand that these topics are completely illegitimate and driven by emotion and not driven by an authentic distress and authentic disdain. And so once again, I often encourage partners to be comedic in their willingness to hear about their bushy eyebrows or to hear about that they might have bad breath, and to not personalize that. Persons with relationship substantiation almost always carry a co-diagnosis, comorbid diagnosis of perfectionism. There is a never-ending scrutiny of their partner when you have this subset of OCD. It's very driven by the idea that one should feel a certain way in a relationship. And that kind of rule-bound attachment to processing one's partner through not only the emotional component of I should be feeling attracted, I should be feeling in love, I should be feeling passion, has these very inverse effects. The idea of looking for love detracts from experiencing love. And the idea of being very rule-bound in how should people function in relationships, how should their partners function, and to then take those rules and see that the person that they're with doesn't uphold those rules. With this subset of OCD, there's almost always a coexisting perfectionistic personality style. Treatment for relationship substantiation often will involve bringing the significant other into treatment with the patient. It's difficult often for the partner to hear that they've been under such incredible scrutiny by their partner, or that their minor defects have created a tremendous amount of distress. But I always try to educate the significant others of my patients that these focuses have no legitimacy. Once again, we always go back to the reminder that OCD is predicated completely on a malfunctioning in the emotional system of the brain, and there's no real authentic link between the person's actual concerns and the legitimacy of the association or the topic. And for the most part, I found partners to kind of get that. For the most part, I found that the relationships of people with ROCD are actually some of the most healthy relationships I've ever run into, and I do a lot of marital therapy, so I'm a bit of an expert to really gauge the quality of relationships. It's often common that partners of people with ROCD can see their partner's concerns as being bizarre and unrealistic and illegitimate. And in those cases, it's easy for the partner to engage in a kind of comedic response. You know, to be in bed with the partner and say, okay, it's okay that you're not enjoying this, it's okay that you're just a mannequin without any emotional experiences, so that the patient takes off their focus and pressure on having these sexual responses act as confirmation and reassurance. I think recovery with ROCD would look like the person engaging in the natural complexity of any relationship. All relationships are complex and have challenges and deserve endless maintenance. But a person in recovery would take on these challenges in a way that didn't involve a paired emotional distress signal.